And today I would like to break down a critical topic, hypoxic drive in patients with COPD. Now, in my video on COPD, I kind of touched on hypoxic drive, but I want to take some time today and kind of go over the actual concept of it. So hopefully by the end of this video, you'll clearly understand what is it, why it matters, and how it affects, nursing care. So let's get started. Alrighty. So in a healthy person, the primary drive to breathe is controlled by the level of carbon dioxide in the blood. And when those CO2 levels, those carbon dioxide levels rise, chemoreceptors in the brain signals us to breathe faster and deeper to blow off that CO2. Okay. And because if you retain the CO2, because the levels are rising, the patient will go into respiratory acidosis. So when those levels rise, the body's like, wait, hold up. I need to take some deep breaths. I need to breathe faster. I need to blow off this CO2. And that's called hypercapnic drive. Okay. So in COPD, especially in chronic bronchitis and emphysema, patients often have chronically elevated CO2 levels. And this is due to poor gas exchange. So over time, the body becomes less sensitive to those high CO2 levels. So instead of the carbon dioxide kind of triggering the body to breathe, the body begins to rely more on low oxygen levels to stimulate breathing. And so this is what we call hypoxic drive. So as nurses, this matters when we administer oxygen therapy. If we give too much supplemental oxygen, we might raise oxygen levels so high that the patient's hypoxic drive is going to diminish. It's going to go down. And in rare cases, this can cause hypoventilation, which will increase your carbon dioxide levels. You're going to retain CO2, leading to, like I said a few seconds ago, respiratory acidosis. So, when we talk about hypoxic drive, here are some key takeaways. Oxygen, yes, is absolutely necessary for COPD patients when they are hypoxic. We're going to be following the doctor's orders, but understand that we just need to use oxygen carefully. Usually trying to target that oxygen saturation between 88% and 92%, unless otherwise directed by the healthcare provider. We need to look at the ABGs. Definitely monitor a patient's respiratory status when we're, adjusting that oxygen therapy. Because remember, oxygen levels get too high on a COPD patient, the patient is going to begin to hypoventilate, meaning they're going to breathe slower. And also remember that respiratory drive is really complex, but understand that not all COPD patients will lose carbon dioxide. So, or that carbon dioxide, I apologize. They don't lose that carbon dioxide sensitivity, okay? So there are some COPD patients who will still, those carbon dioxide levels go up. It's going to cause the body to breathe faster and breathe deeper to diminish or get rid of that carbon dioxide. So it doesn't pertain to all COPD patients. But just kind of remember that. So that's why we always go in and assess our patients. If we do a new intervention, we always go back and reassess. We're always assessing our patients, especially after we change a medication, change the level of O2. Any changes, administering any antibiotics, medications, or anything, we always go back and reassess. And so this is the same. We are titrating a patient's oxygen. We know they have COPD. We want to go and reassess our patient. So, understand that oxygen should never be withheld when it's needed. And like I said not a few minutes, but a minute or two ago, we want to keep those oxygen levels, that oxygen saturation, between 88 and 92%. All right. So to kind of give a quick summary of hypoxic drive, healthy people breathe because of rising carbon dioxide levels. Okay. COPD patients with chronic CO2 retention may switch to a hypoxic drive. Too much oxygen can suppress their drive to breathe. And lastly, as nurses, we are going to titrate oxygen therapy very carefully, and we're going to monitor our patients closely. And that's really it. So understanding hypoxic drive will help you provide safe, effective care when you're taking care of your COPD patients. So if you found this helpful, don't forget to hit that like button. Subscribe, please, to NurseEdScholar. I will continue to give simplified nursing content. And share this with a classmate. This really helps the channel. I'm trying to summarize everything for you to be successful in nursing school. And so that's it. I'll see you next time for NurseEdScholar.